There are 5 different types of step-by-step reports to rule out the heart attack when patient is having chest pain. Let's start with the report number 1. ECG, which in full form we say electrocardiogram. If patient's ECG looks like this ECG, then it's normal. But if it looks like this or this types of ECG, then it is a clear-cut indication of patient having a heart attack. This is called ST elevation myocardial infarction, which is a major heart attack. But if ECG is normal like this ECG, and patient's symptoms are still looking significant, then we should move to our second report, which is othe echocardiography. Othe echo is a 2-dimensional study of the heart with sound waves. It is done by the cardiologist who examines the patient's chest for a couple of minutes with the device called transducer. This report gives information that whether heart has received any damage or not, or how much the heart is healthy. Damaged heart indicates possible heart attack, which can be confirmed by our final report. Othe echo also gives information about heart's valves and other important structures of heart. If the othe echo report is normal and patient's chest pain is still significant, then we should move to our next and third report, which is cardiac markers or cardiac enzymes. This one is a blood report. It is diagnosed by the enzymes present in the blood, which is released by heart while receiving damage due to the heart attack. And the enzymes are CPK-MB, Troponin-I, and Troponin-T. These enzymes are present in blood after a few hours of chest pain due to heart attack. CPK-MB seen in blood after 3 to 12 hours of chest pain, and it will remain present in blood for 2 to 4 days. While Troponin-I seen in blood after 6 hours of chest pain, and it will remain present in blood for 1 to 2 weeks. And Troponin-T also seen in blood after 6 hours of chest pain, but it will remain present in blood up to 3 weeks. If these reports are normal, but there is still doubt about having chest pain due to heart attack, then we should move to our next report, which is TMT, treadmill test, or we can also say cardiac stress test. Treadmill test starts by making your heart pump harder and faster, and healthcare providers access your response to the increased workload by measuring blood pressure, heart rate, oxygen level, and electrical activity in your heart. These measurements are measured every 3 minutes, after making treadmill faster every 3 minutes. Treadmill test is very commonly performed to learn how well your heart pumps blood, whether your heart is receiving an adequate blood supply, how you perform on physical activity compared with other people of your age and sex, and if your symptoms like chest discomfort and shortness of breath can be reproduced while performing physical activity. If this report is also normal, and there are still doubts about having heart problems, then we have to move towards our last and final report, which is CAG, which in full form is coronary angiography. Coronary angiography is a full and final report of heart attack, because it gives a visual proof of heart attack. In this report, a wire inserted in the body through blood artery, which goes to the heart, and then few dynamic X-ray video images are captured, which shows the heart's blood vessels whether they are normal or blocked. Blocked vessels are foolproof reason of person having chest pain and heart attack. If patient's coronary angiography report is normal, and patient still having chest pain, then it is not due to heart attack, and we should look for some other reasons except heart attack.